At Healthcare Partners Medical Group, our mission is to provide the highest quality of healthcare to each and every patient. With 5 locations in Pahrump, we are local doctors you know and trust. We want to thank you for choosing us. Quality care starts here.
Pahrump Nugget, Progressive Cash Drawings, Mystery Point Multipliers, Mystery Gift Days, Extra Cash for 4 of a kinds, Bingo, Bowling, Football, and Food Specials. Looking for constant action? Look no further. Pahrump Nugget Hotel and Casino.
You're watching KPVM News 46. Weekend Review. With Deanna O'Donnell. And Jason Koblenz.
Welcome to News 46's Weekend Review, your #1 source for local news. I'm Deanna O'Donnell.
And I'm Jason Koblenz. The Supreme Court ruled in a 5-4 decision this last week in favor of the Affordable Health Care Act.
In their decision, the Supreme Court states that in 2010, the Congress enacted the Patient Protection and Affordable Care Act in order to increase the number of Americans covered by health insurance and decrease the cost of health care. The key provision is the individual mandate, which requires most Americans to maintain minimal essential health insurance coverage. For individuals who are not exempt and who do not receive health insurance through an employer or government program, this means of satisfying the requirement is to purchase insurance from a private company. Beginning in 2014, those who do not comply with the mandate must make a shared responsibility payment to the federal government. The act provides that this penalty will be paid to the Internal Revenue Service with an individual's tax and shall be assessed and collected in the same manner as tax penalties. Another key provision of the act is the Medicaid expansion. The current Medicaid program offers federal funding to states to assist pregnant women, children, needy families, the blind, the elderly, and the disabled in obtaining medical care. The Affordable Care Act expands the scope of Medicaid program and increases the number of individuals the states must cover. Lower income and middle class families will be eligible for subsidies to help pay premiums starting in 2014. There's also an added safety net for Americans insured and uninsured. Starting in 2014, insurance companies will not be able to deny coverage for medical treatment, nor can they charge more to people with health problems. Seniors also benefit from the law through better Medicare coverage for those with high prescription costs and no co-payments for preventative care. But hospitals, nursing homes, and many other service providers may struggle once the Medicare cuts used to finance the law really start to bite. Illegal immigrants are not entitled to the new insurance coverage under the law and will remain one of the biggest groups uninsured. Experts expect costs to keep rising, meaning that lawmakers will have to revisit the issue perhaps as early as next year, when federal budget woes will force them to confront painful options for Medicare and Medicaid, the giant federal programs that cover seniors, the disabled, and low-income people. The healthcare overhaul focus will now quickly shift from Washington state to state capitals. Only 14 states plus Washington, D.C. have adopted plans to set up the new health insurance markets called for under the law. Called exchanges, the new markets are supposed to be up and running on January 1st of 2014. People buying coverage individually as well as small businesses will be able to shop for private coverage from a range of competing insurers. The Medicaid expansion would cover an estimated 17 million people who earn too much to qualify for assistance, but not enough to afford insurance. The federal and state governments share the cost, and Washington regularly imposes conditions on the states in exchange for money. Since the penalty for not purchasing minimally adequate health coverage is essentially a tax, the court ruled it constitutional. The Urban Institute concluded that 18.2 million Americans, 6% of the population, will be required to purchase coverage. Of that, 10.9 million low-income people will be eligible for federal subsidies to help pay for coverage. Just 2% of Americans, 7.3 million people, will have to buy new coverage and won't receive federal subsidies to do so. With this law, you cannot be denied coverage for pre-existing conditions. Small business owners will be eligible for billions of dollars in tax credits to help employees pay for coverage. Immunization and preventative care must be offered at no cost. Enrollees' dependent children up to age 26 will receive coverage. An appeals process will be set up for consumers who can appeal insurance company decisions. Insurance companies will be blocked from imposing excessive premium increases. Arbitrary lifetime limits on coverage in all plans will be removed. Insurance companies will be blocked from dropping coverage while a patient is sick. And as of January 1st, 2014, all low-income individuals who are not disabled or elderly will be eligible for Medicaid. You must earn less than $29,000 per year for a family of 4. However, the federal government will not be able to deny states' existing Medicaid funding if the states decline to opt in to new Medicaid expansion. The Medicaid expansion will cover 17 million more people. Currently, 62 million Americans receive coverage under Medicaid. Businesses with fewer than 50 employees will be exempt from the mandate. However, they could earn tax credits for paying employee premiums if they do so. Businesses with 50 or more could opt out and pay a penalty, which might be much cheaper than the premiums. The decision leaves in place the so-called individual mandate, the requirement on Americans to have or buy health insurance beginning in 2014 or face a penalty. What does this all mean to you? Well, in 2014, the penalty will be $285 per family per year, or 1% of income, whichever is greater. By 2016, it goes up to $2,085 per family, or 2.5% of income, although many Americans are exempt from that provision. Healthcare exchanges, which are designed to offer cheaper health insurance care plans, remain in place as well. I'm Deanna O'Donnell for News 46. Commissioner Butch Boraski has put an item on Tuesday's County Commissioner's agenda that calls for a November ballot question of the dissolution of the town board. The commissioner says he has been asked by many citizens to give them an option to vote for or against the board.
I have many people that have come to me within the last 2 months, 3 months, and they're really upset with the town board, what they're doing, how they're spending money. And I've held back and tried not to get in the middle of this thing, but I finally said, I have to do something. I have to stand up for the people who they want their voices heard. Now, we're supposed to live in a democracy where it's a constitutional republic, and people should have the right to voice their opinion. I don't believe the town board is listening to them. I don't believe they're listening to anybody right now. I believe there was something in the newspaper this morning about Vicki Parker saying that it's a county doing a money grab. We're not out to grab any money or anything else. The only thing we want to do is put a ballot question on. It says, do you want to keep your town board? And there'll be a little more information on that ballot question. It's the only thing I want to do. I'd also like to see incorporation on that, but the town board said they would handle that, they were going to do it, and then they backed off. And then Kobarger gets calling me on the phone, starts raising hell about, well, I said I would do it. And I said, Bill, I've never been for incorporation. So if the town board wants to put incorporation on there, I'm going to have doing away with the town board. We'll let the voters decide, and we'll live with whatever they say. Do I believe that they'll say to get rid of the town board? I doubt it, but it's up to the people. Let us have our chance to voice our opinions and use our constitutional rights while we still have some left. If you notice, Obama got a big victory the other day on this healthcare thing. And believe it, boy, you would start reading that document, you're going to wish that it was never approved, because it's going to get us all.
The county commissioners will be voting to perhaps put the dissolution of the town board on the November ballot. So this is up for you guys to first vote on, and then up for the citizens to vote on. Yeah, naturally, and there's 5 board members. It will be if 3 or more decide to move forward, and I'm not going to make any predictions on that right now. I'm sure that Dr. Waters sent me a pretty nasty email, said he wasn't disappointed with me. Right now I'm disappointed with all of them. They're not listening to the people. It's our constitutional right to voice our opinion. They've fixed their agendas so that you can't talk only a little bit in the beginning, a little bit at the end. They ought to look at the commissioners' agendas and see how we do it. We allow public comment on all issues that concern the public. We could save money
probably a couple of $1 million a year if there was only one level of government here. And that money could be put back into roads or something like that. You need to look at these things. You know, we've got too much government now, and we need to back it off.
The Nye County Sheriff's Office will not be receiving additional funds to patrol Petrick Park on the 4th of July. They went before the town board to ask for a total of $3,800 for additional law enforcement for the Liberty Festival.
I guess there's some questions that are going to be asked why we are charging the town of Pahrump. Basically is that we gave you this list in July 2011 without a charge. We went, and we've been saying to town since 2008, we're going to have to start charging. This budget coming up is making very tough with the raises that are included in the new budget and the budget not reflecting those raises is going to cause us a strain in Nye County Sheriff's Office that we are in turn have to request that before we provide any extra service for the community that it be paid for. The reason why Tonopah wasn't charged in 2012 and why Town Board wasn't charged in 2011 is, when does your budget year start? Anybody have the answer? July 1st, 2011. When does it end? June 30th, 2012. Providers are going to provide 4 deputies between the hours of 1,400 to 2,400 hours. That's a total of 40 hours. And we're going to provide 6 deputies from 1,800 to 2,400 hours. That's for a total of 36 hours, which is a total of 76 hours. They're going to be on overtime, so we have to calculate their pay and the benefits they get with that, which is estimated about $50, which totals about $3,800.
I don't want to get into specifics, but I'll simply say that I don't agree with some of the things that your money has been spent on your budget.
And that would be Mr. Culkin, please, because you know what, sir, and no disrespect, I hear this all the time. I've been doing this job for 39 years in this profession. Sheriff since 2003, deputies since 1999. And our services are basically in this, putting deputies out in the street and making sure that when we have a crime, the resources of that crime gets, the resources we have gets diverted to solving that crime. Nothing else. Nothing. You're the one who asked us to put this on the agenda. It's just a town event. You're responsible for whatever happens at the town event. We're telling you that the event's going to be quite a bit of people, and even with that, you're still saying that you're not going to provide adequate police services because we only have a few deputies that are out in the street. I couldn't call anybody in overtime, which would impact my budget. So whatever your decision is a decision that you live with.
Do we have a motion? Seeing none, let's move on to number 10.
The 4th of July is just a few days away. Sheriff Tony DeMeo explains the law in regards to the fireworks in Nye County.
They're illegal to actually purchase in Nye County, and they're illegal to set off. And I think anyone looking around at the drought we've been having for the last several years, realizing that BLM, U.S. Forestry Service, and the emergency management within Nye County and the fire chief locally has stated that we are on a high fire alert, and that any type of spark or any type of ignition of fire would put the county, the Pahrump Valley and the county in danger, depending upon what the fire is. So I would say that no, they can't sell fireworks, and I would suggest that even those people with light-lit cigarettes don't throw them out the window. Spark, any type of a spark and arcing of electricity can cause a fire. In fact, right now they're battling a fire up in northern Nevada that was started by an arcing of electrical wires. So, and looking at the other fires that are going across the western United States, realize that anybody who did that would not only be totally irresponsible, but prone to prosecution as arson. That's an arson charge.
There's several fireworks stores here in town where
several. But go ahead.
They're selling fireworks. Are people allowed to transport them past the county lines? What's the laws regarding?
Well, every county and every state has their own laws, and I believe that that Las Vegas Metro, in conjunction with NHP, are enforcing the fireworks laws in their county, and I believe that California is enforcing the fireworks laws in their state. But we do not have any California fire marshals coming into Nye County to writing out license plates and so on and so forth, which they did in the past. But people should be real. If you buy fireworks and they're illegal in those areas, that they're due to be confiscated, and pretty much they ought to be setting up. I think he's setting up roadblocks on that to check and verify.
So they might be having roadblocks around this time of year right now to check for fireworks.
That would be up to individual jurisdictions. Yes.
And we'll be back with more of News 46 Week in Review right after this.
Current suicide rates are some of the highest they have ever been. Nye County ranks among the highest in the nation. There are 1 million approximate number of suicides worldwide each year. In fact, every 40 seconds, somebody dies by suicide. There has been a 60% increase in worldwide suicide rates in the last 45 years. There are 20 numbers of failed suicide attempts for each successful one. And women are more likely than a man to attempt suicide, while men are much more likely to succeed.
Nevada has fluctuated from number 4 to number 8 in the nation as far as suicide rates. There's a group here in Nye County, Pahrump, that is helping to provide resources to people in need.
Well, we're trying to educate people on signs of suicide. We're trying to give our people better coping skills when they feel that they're depressed and there's nothing for them in life anymore. We're trying to raise funds. We are going to be doing counseling and training counselors. Outside of that, we are in the community talking to people. We are grassroots effort. Tammy started this off. She hired me as her executive director. Tammy, you have...
Tammy, how long have you been doing this for out here?
I've been working on it since probably last spring. Linda from the state used to come out and do the suicide awareness classes. She trained me to do the 1 hour and 4 hour classes. We did the walk last September. This year we're going to be doing it again September 15th in Dutch Park, and it's Walk in Memory, Walk in Hope. And we're looking for committees right now, so anybody out there wants to be involved and wants to help out, please call me at 702-266-4926.
How received has this been out here? Has this been a well-received thing? Because a lot of times suicide is kind of a taboo topic with a lot of people. Has this been well-received so far?
Yeah, it has been well-received. I think people realize that it's a problem here, considering that we're number 4 in the nation. As far as
it rotates.
suicides.
Between the last 20 years, we've been in the top 5 every year, just about.
Yeah. So it's it is a big problem. It is well received. It is a dark topic. I mean, people don't like to talk about it because, what did I do wrong as a parent? Why didn't I recognize the signs? And we want to help the families that lost people. We want to help people that are going or trying. We have to make people aware that when people say it, to take it seriously, that they mean it. When someone says, I'm going to kill myself, don't just walk away and say, well, everybody says that. Look at the person, talk to the person, look into their eyes, and their body motions, and see, what's going on.
And a lot of the concern with most people is within their families, but it's also something that you guys try to bring awareness about, is that you need to be looking for this with other people in your community aside from your family.
Right now we have a training once a month. Paul comes out from the VA hospital in Vegas. He's their suicide prevention coordinator, and he gives a wonderful talk on everything to look for. And even though it's geared towards veterans and PTSD, I've sat through 4 of his classes. They're all different. And it depends. You get to ask questions, you get to learn the signs, get to know what to say, and get to know who to call, when to call, without overreacting or without missing a sign. So it's real important. We have it now is every last Friday of every month, and it's at the hospital from 1 to 3. So we hope to fill the room this time.
The 3 deputies who were on duty at the June 12th town board meeting are now apparently filing charges against the Nye County Republican Central Committee.
We spoke with them. They are filing charges. They're getting the process now. They're going to send the statements that people filled out that night along with some additional statements we got, some reneging this previous statements. We're saying that going to be sent out to the DA's office for review. The deputies are going to file their charges against the individuals that place them under arrest, then place them under arrest again. Apparently they were arrested twice. So they're filing their charges with that. We take those things very seriously. You don't tell someone they're restricted of their rights of freedom of movement and place them under illegal arrest without some type of making sure you're correct in that respect. But also because the fact of the matter is it's a restriction of freedoms. You're taking away someone's right, that's rights to be free. So we know what the consequences of placing someone under arrest are. And deputies didn't take that kind to it. They didn't look at it as a joke. This person or people involved placed them under arrest. Then they were told they were under arrested by somebody else, which they didn't have the ability to do that. And that's only the ability of the person that actually put them under arrest outside of a law enforcement. And they were placed under arrest again. So they're fine charges, yes.
The Nye County Republican Central Committee chairperson Bill Carnes says that he had nothing to do with placing the deputies under arrest. Is he going to be included in this?
It would be the person that placed the deputies under arrest. The only problem is that these people were acting under the authority of the NCRCC. And individually, it's kind of tough sometimes as an individual to be placed in violation of a constitutional violation, or civil rights violation. But organizations can be. Look at the U.S. Department of Justice is filing civil liberties charges against an organization, religious organization, because that group is denying people the right to be of their freedoms of religion. So maybe an individual would be very difficult to charge them with some kind of civil rights violation. And that's not the area we're going to go. But when an organization, when people act on behalf of an organization, that those people then can be, if it was going another way, if they actually place somebody under arrest, they could be charged with civil rights violations.
You had 3 officers, was it more, that were there, and one of them happens to be, you can see on the videotape, Harry Williams, who is a SWAT team member, very calm. They're going to be receiving certificates tonight from the Pahrump Town Board. Did you guys talk a little bit about how they would be reacting there? Was this in their training? When the things got very heated, they seemed to try to calm it down.
Well, that's what their training is about. Their training is to make the situation better if they can. And that depends upon the individuals participating in that, both sides. The deputies I informed Captain Beck to have the street crime unit there, basically because the fact matters they're plain clothes. We don't want anybody's presence for uniforms, being that their rights are going to be infringed upon and all the things that go on with that. But they're very knowledgeable officers.
During a recent meeting, County Commissioner Lorinda Wickman spoke about an article in a local newspaper she said misquoted her.
In May 31st Mirror, there was an article in there. It says, county moves to have federal lands returned. That was wrong. I understand how the leap was made in my conversations from Lorinda wants to work on a land bill, and can I have the approval of the commissioners to do that? But I also, during the same meeting, I also informed the commissioners about what was taking place in other states to take all of the federal lands back and put them in state hands. Somehow or another, that got pushed in together, because it says in here that the stars have lined up, and that Commissioner Wickman is in the hope of returning all federal lands to the state. No, I'm not. I am not. I just want to make that perfectly clear. The land bill is for some specific items that we need around the communities in this county, like around the airport here in Pahrump. We need land around the airport in order to expand the use of that airport. There are a few places in other communities where we need some expansion land. There are cemeteries that are on federal and managed lands that we need to take control of so that we can do the work that needs to be done there. So there are specific items that I would like to pull back into Nye County. Whether the state and federal lands, whether the federal lands all come back to the state or not, to tell you the truth, I don't care as long as they're managed properly. I don't care where the stuff lies. I just wanted to make sure that everyone understands. I did not say that we need to take back all of the federal lands. Thank you.
And the Public Health Clinic, Veteran Services, Senior Nutrition, and the WIC program will be relocating to their new facility on Calvada. For 3 weeks, these services will be unavailable.
Yes, this is going to be the new home of Veteran Services, the health nurse, and senior services.
They're moving from their current location on Highway 160 near Basin.
Yeah, we call that the 250 building. They'll be moving from there over to here.
And this is in the middle of Calvada right here. All the services from that location are moving, including WIC, but we're going to be kind of having some services on hold for a little while.
Well, yeah, the move is going to take so they can get everything situated here before they open back up, but it shouldn't be too long. And this is a nice facility, and all of it's in one place, and it's going to be a wonderful thing for Pahrump.
This is a brand new building.
Yes, it is. We had the money to do this from the health fund, and we've worked to get this done so that we can do other things with the 250 building.
Some of the things that are a little bit better for the services that are going to be held in this building.
Yeah, it'll be easier for the people that are using the health nurse and senior services and Shirley Trumbull's office, and the veterans. It'll be easier for them to get in and out. We'll have handicap parking so that they can park and get out of their wheelchairs and such forth. So yeah, it's going to be a lot easier for the public, and it's going to be a lot easier for staff to take care of the people of Pahrump and Nye County. We want to try to make it as comfortable for the clients that the county is bringing here, and one of those things is making sure that they're comfortable. People that are using the health nurse are either sick or something's wrong with them. So, you know, we want to make it comfortable for them, and we want to make it easier on them, and we want to make it easier on our staff also. And that's the reason this building was built, because it's a one-stop shopping. You can go from Shirley Trumbull's office to the health nurse to the Veteran Service office all in one day.
What's Shirley Trumbull's office do?
Takes care of the senior nutrition, welfare, that kind of thing.
And so
senior nutrition.
you also have a little area where you can drive your car right up to the doors here in case.
Yes, I mean we're making this as business friendly as we possibly can for the clients that are going to be using this. And if you're coming to see Maureen Boudal or Shirley Trumbull and the senior nutrition or the veteran services, Geneva will be back there, take care of you, and make sure you have an appointment, and make sure that Ken's there to take care of you.
So these offices will be officially opening on August 1st. The other services will be closed down for a little while for the move, the actual move. So what should people do in between preparing for this move? Because these services will not be available for a couple weeks.
I would, excuse me, I would suggest that they get with Shirley Trumbull before the move, or go to the health nurse before they move, or at least make arrangements for whatever the client needs to be done. Veteran Services, the same thing, because it takes a lot of time to move these records and these desks and all the furniture and put it back in, get it in line the way they want it.
Once again, the Public Health and Clinical Services will officially close down on July 9th. There will be no services available until August 1st. They will be closing down and reopening at 1981 East Calvada. So that is just a short time away. If you think that you might possibly need these services, you're urged to go and take care of that ahead of time. This is Deanna O'Donnell for News 46. And we'll have much more local news when News 46 returns.